Today I'm going to demonstrate some basic movements of the lumbar spine. These are great movements to test your flexibility, as well as to use as exercises to loosen yourself up before you get to working out or before you get your day started. So let's go ahead and take a look at how this works. The first movement is called extension. Extension refers to the direction of movement, which is a back bend. So to cause a back bending action of the lower back, this movement is best performed in lying on your stomach. This movement looks very similar to the yoga pose called cobra. Let's see how it works. To begin, you should lay on your stomach and then place one hand underneath each shoulder. In this position, I am going to push through my hands, raising my upper body up into a back bend for the lower back. I'm going to perform this movement 10 times to loosen up my lower back so that my movement into extension is nice and loose and warmed up. If you can't go as far as I'm going, that's okay. With the arms, you should only go as far as you can. So if you feel a good sufficient stretch about this far, that's as far as you should go, and then come on back down. Others may not even feel a sufficient stretch by getting their arms straight if you're very flexible. There is a solution. You can grab a foam pad like this to elevate your hands. And so you should put this underneath your hands and then perform the movement so that you get a little bit further into that back bend. And that is how you get extension for the lower back. The next movement is called flexion. Flexion is a forward bending action of the lower back. This is also sometimes called double knee to chest stretch, and basically what we're doing is just getting a rounding of the lower part of the back. Let's see how it works. So to flex the lower back, we are going to bring the legs towards the chest like so. I will start lying on my back, and then I'm going to bring my legs up towards my chest, and then once I bring them up a certain amount, I will just give them a very gentle pressure on the legs here just below the knees. 3 seconds right there, and then come on back to the starting position, and then I'll repeat that movement up to 10 times. As I go through this movement, I'll notice that my back is loosening a little bit, so that's good. I can go a little bit further with that stretch as I continue. I may have felt stiff in the very beginning, but as I keep going, I can bring my legs closer to my chest, and that demonstrates that there's a loosening effect there. If you find that it is not loosening up, that's okay. Just go as far as you can go until you feel a stretch. You should not feel any pain while you do this. If you do, you should likely stop, unless after doing a few repetitions you notice that that pain goes away. The next movement is called a side glide, which is also referred to as a lateral movement. Lateral refers to the fact that the spine is now moving side to side instead of forward and backward like the previous two motions. And so to perform this, the best way to do it is actually in standing. Let's see. To perform the side glide in standing, I'm going to stand with my feet about hip and shoulder width apart, and I'm going to place my hand on the pelvis right about at the belt line on one side. For this movement, I'm going to be performing a side glide to the left because my upper body, my upper trunk is going to go to the left while the pelvis and the lower half is going to go to the right. So to move in this way, I push on the pelvis and glide over to the opposite direction. And so this is performed repeatedly to feel the stretch, to feel the movement. You can check the opposite direction. Now this is a side glide to the right. My hand is on the belt line at the pelvis, and I'm pushing over while gliding over to the right. One thing to note is that I am not doing a side bend movement where I'm letting my body kind of hinge or so. This would be a side bend. That is not what I'm doing because that kind of is only a very specific type of lateral movement and doesn't really target the lower back as much. So if you want to target the lower back, you have to perform the side glide movement. This next movement is performed on your back and is also considered a lateral movement. In this movement, we are going to be turning the lower part of the back and also moving slightly laterally. You may feel this stretch in different areas of your body. However, the focus of it is to move the lower back in rotation. Let's see how it works. And so to perform this lateral movement, I'm going to start off by laying on my back, and I'm going to bring my legs up towards my chest like before. However, I'm going to stop right about here when I'm at a 90-degree hip angle. And so once I'm here, I'm going to bring my legs over to the side. And when this happens, the spine is rotating. That is the lateral movement there. Once I get to this position, I'm going to hold for 3 to 5 seconds. Come on back to the neutral position. Okay, I'm going to repeat that movement, get to that 90-degree angle, rotate to one side, and then feel the stretch. You should feel some sort of stretch here in the lower back. Some people may feel more of a stretch in the hip area, and that's also okay. Just like before, you should move as far as you feel comfortable. If you find that you're going too far and that you feel too much of a stretch, don't push yourself. Only go as far as you feel comfortable. If you go to about here and you have to stop, that's okay. And then come out of it. The opposite direction should be tested next. I recommend testing one direction before doing both sides alternately. And so legs come up to that 90-degree angle, come on over to the side, feel the stretch, and then come out of it. So these are 4 motions of the lumbar spine where you test its ability to bend backwards, the ability to bend forwards, you test your side glide movement, and then you test some rotational component. It's a great way just to see what is the state of my tissues, how flexible is my lower back. If you experienced any sort of pain or discomfort with these maneuvers, you realize that you do have something going on there and you should be gentle with those movements that didn't feel so great. If you found that by doing these movements you felt looser and felt better, then this is a good exercise type of routine to get into because you're getting your tissues mobilized and you're moving them. The lower back is often one of the most neglected areas of the body in terms of mobility. And so this is a good way to stretch that area of the body, gain some flexibility, and just feel better overall so that when you get to your activities, your heavy use activities, such as any kind of physical work that you do, exercise that you do, or anything else, you feel better, you feel looser, and you can do it with less risk of injury. I hope that you've enjoyed this information. Thank you very much. Have a great day.